Taipei Tzu Chi Hospital looks after a young COVID-affected patient, Tingting. In Malaysia, many charity organizations gather medical supplies on behalf of hospitals. Welcome to DaAi Headlines. I'm Hu Chao. Glad to have you here. Tingting, an elementary school student, is confirmed positive for COVID-19. The child and her father stayed at the Taipei Tzu Chi Hospital for treatment. Tingting is an introverted child, thus the hospital staff would take special care to accommodate her. The considerate actions have moved the father.
Here is Tingting still doing remote learning inside the COVID-dedicated hospital ward. She is a quiet patient. The nursing staff prepares special gifts for her to combat boredom and also uses a friendly voice to interact with her.
When you're wrapped up in protective gear, patients sometimes get scared. So we try to use friendly tones with her since she's shy. Sometimes she'll reply back in timid tones.
Actually, besides her and her father, other people in her family have been sent to the Taipei Tzu Chi Hospital by the Health Bureau. The medical staff's detailed care has impressed Tingting's father.
We are blessed to be able to receive the care under Tzu Chi Hospital. Speaking on this, I'm so moved. When they ask me if we have any needs, they'll reply and set in action quickly. We are so thankful to be under your care, so thankful.
Tzu Chi's healthcare workers take care of each patient like their own family, as they hope the patients feel their love and support.
At the frontline against COVID-19, dedicated ward Dr. Zhang Zherui devoted more time into saving COVID-19 affected patients in dedicated wards. Being an attending physician for 3 years, he is fearless as he sets out to help more patients in need. Let's take a look at his story.
那个菲律宾电子厂的员工，目前的话就是已经没有血痰的部分了，而且状况也稳定。就去年，新冠肺炎刚开始的时候，其实第一线接触的其实就是急诊。
When the pandemic first started, at first we had to deal with patients. Therefore, we are more careful in protecting ourselves. Actually, we have standard procedures, including the intubation process. We will run the process first. Like the training course yesterday, colleagues from our emergency department will be leaders in our groups, giving everyone experience.
当一个 leader 来让大家多获得一点经验，这样子。
现在病人现在都还是带着 NIM 哦。好，病人开始抖了，好，没有呼吸了。
等他抖完，我们把床头放下来，准备插管。我们部长在跟我谈的时候，事实上我只有打过一剂 AZ 而已。
When I talked to my director, I only had an AstraZeneca vaccine shot. So at the time, I was worried if I would infect him or my family members. There might even be infections caused within the hospital. Therefore, I was very worried, even worrying about if I would suffer from severe symptoms, just like what happened during SARS. During that time, young doctors come into contact with a patient's saliva during the intubation process. Then they will die of severe symptoms.
就是沟通的话，因为有遮蔽的关系，所以不是那么清楚。我们可以就是有一个对讲机，像 ICU isolation room 那种对讲机可以。
Facing unknown enemies, Zhang Zherui believes in his years of professional training as he bravely takes on his duties.
用纸条的方式传递。那目前日不能够可以到98%。
On this day, the dedicated ward took in a COVID patient who is also undergoing dialysis.
进来的时候其实比较忧郁一点点，因为然后也一直跟我们道歉说他也不知道为什么他会得这个病。
When she came in, she was depressed because she keeps on apologizing to us. She also didn't know why she contracted the virus. So when she arrived, she had breathing issues and fever. After treatment and undergoing dialysis, she once had pulmonary infiltration and asthma. Considering the seriousness of the situation, we transferred her to an ICU and gave her more medicine. Afterwards, her conditions improved.
加护病房有帮他洗肾跟额外增加一些药物，那看起来他的状况有变好，肺部浸润也有改善。
我是讲我可能活袂落去啊，所以我搁这心，搁念着这，对我人生实在足痛苦，足痛苦。
I thought that I wouldn't make it after undergo dialysis and COVID treatments. It's tough. It really is tough. I'm thankful to the nurses and doctors here. They look after me every day, giving me courage to move on. I'm so thankful to you.
急诊就是稳定病人，然后让病人有一个好的去处。那专责
The emergency department aims to stabilize a patient, then transferring them out to a better place. The dedicated ward hopes to improve a patient's situation, then discharging them from the hospital. During the month, we talked to different doctors, including both frontline and backline medical workers. I discovered gaps during our discussion, and I understood the worries of backline medical workers. I believe that moving on, during the procedures of an emergency department, both the frontline and backline medical workers will have an easier time communicating.
那你现在还会那么晕，还是有比较好？帮你打针之后有没有比较好？
Doctors have to know more, not just knowledge within our field. He actually has to learn from patients. Since what we learn in books is stale, we must learn practical things from patients. If this is done, our experiences will benefit us. Just like what Master Zheng Yan once said, we don't just heal the body, we also heal the person, while doing so with a good heart. We must consider the patient from multiple perspectives, and then make the best possible decision for the patient and ourselves. The CDC purchased monoclonal antibodies, hoping to lower the mortality rate of seniors and the patients with severe symptoms. The antibody treatment aims to help people over the age of 55, and it will also control the conditions of patients of mild or moderate symptoms. Let's take a look at the process of monoclonal antibody therapy. Some patients are above the age of 65, or for patients above the age of 55, if they have chronic diseases. The quarantine location will then send them to a hospital for monoclonal antibody therapy. This is to prevent further development of severe symptoms. CDC declared purchases on monoclonal antibodies, hoping to reduce the rate of severe symptoms of patients with mild or moderate symptoms. In Taiwan, the mortality rate of COVID-19 has once been higher than the global average, 3% in June and 4.88% in July, higher than the global average of 2.16%. Monoclonal antibody therapy actually splits into two parts. The first part is for patients who are asymptomatic. The treatment allows this type of patient to avoid severe symptoms. The second part is to ultimately lower the virus count within the patient's body. When the virus enters the human body, it starts by merging with the acceptor, replicating itself in the cell, and then destroying the cell. This causes symptoms and leads up to death. Monoclonal antibodies are designed to stop the virus from entering the cells.
The monoclonal antibody has the virus itself, especially its surface protein and acceptor locations. Therefore, it serves the purpose of blocking the virus, stopping the virus from merging with our cells.
During the global outbreak of COVID-19 last year, a research team in CGU developed a monoclonal antibody as it aims to detect samples from Wuhan, the United States, Europe, and Egypt. It also has the ability to control the virus up to 98%. As of now, the antibody is approved to be used as a medical product.
The theory states that after people suffer from a disease, once they recover, their bodies will generate antibodies. Therefore, we use serums from recovered patients to treat patients undergoing treatment. This is because the serums of recovered patients will have different antibodies. Some antibodies aren't even for fighting COVID-19. These are unnecessary antibodies. Therefore, we thought of designing an antibody that specifically tackles the COVID-19 virus.
At Taipei Tzu Chi Hospital, 4 asymptomatic patients received monoclonal antibody shots. After measuring their cycle threshold, they proved to be in better condition. This is why when patients are receiving the monoclonal antibody shots, they come to the hospital. It's because they're afraid of receiving allergic reactions, shock, or acute interstitial pneumonitis, though the 4 patients didn't have any of these reactions after receiving the injection.
After receiving the vaccination, we generate antibodies. Though the effectiveness of the vaccine will decline, the monoclonal antibodies directly injected into the body, and it stays longer. The duration can last from weeks to even months.
The main goal for monoclonal antibodies isn't the effective duration or the amount of generated antibodies. The main goal is for patients to avoid severe symptoms. In Taiwan, from June 19th to July 1st, a total of 64 people utilized monoclonal antibody therapy. Most of the people are above 55 years old, and people below the age of 50 include pregnant women, people with autoimmunity, and people who received organ transplant. Amongst the 64 cases, Only one case personnel had severe symptoms. Monoclonal antibody therapy is helpful to seniors or patients with latent infections. Not only does it reduce the overall mortality rate, it also helps control the conditions. In Malaysia, as hospitals face shortage of medical equipment and supplies, charity organizations have been fundraising and gathering medical equipment, aiding frontline medical workers during the outbreak.
Due to COVID pandemic, hospitals who treat COVID patients are facing shortage of manpower and medical resources. Therefore, City Malaysia chapter continues to deliver medical supplies to medical workers. In June, they initiated the Medical Assistance Plan 2.0 to raise funds to purchase medical equipment and supplies.
Recently, we have received a lot of requests for oxygen generators. The medical workers hope that before the patient's conditions deteriorate, they can have enough oxygen. This way, they can avoid going to ICUs. We have received more than 7.4 million ringgits in donations from 28,000 people. Compared to our goal in the first term, we are still short of 2.6 million ringgits.
As hospitals face shortage of medical equipment, many NGOs besides Tzu Chi have been raising funds to gather medical equipment and supplies. One Hope Charity and Welfare Foundation, which provides help to impoverished patients, has worked with Tzu Chi to support field hospitals set up by the government to treat COVID-19 patients.
Not long ago, we worked together with frontline staff to battle against the pandemic. We donate medical equipment, hoping to help lessen the medical workers' burdens and ensure hospitals can continue to operate. This way, we can protect people's lives.
Malaysian Relief Agency, which provides all kinds of humanitarian relief, has delivered medical supplies to eastern Malaysia through sea and air travels.
We are now working with a company to deliver the supplies through sea. The company helps us deliver the ICU medical equipment to a hospital.
As charity organizations deliver medical equipment to hospitals in need, they have ensured the medical system can continue to operate and that the medical workers can fight against the pandemic.
NGOs will help government agencies as they have needs. Sometimes, government will seek help from NGOs. It is a cooperation between the government and NGOs. As the country is facing challenges and the medical system is near collapse, we must contribute to help out. We think that by protecting our medical team, we are protecting the health and safety of all the people. It is necessary for us to support them.
In fact, we are supporting medical workers who have been safeguarding our health. Government hospitals are also people's hospitals, as they safeguard the health of all Malaysians.
In Malaysia, affected by the pandemic, many hospitals are facing shortage of medical equipment and supplies. Due to this, Tzu Chi Malaysia chapter is fundraising and gathering medical equipment to support medical workers as volunteers set out to fundraise.
想到那些人在呼吸前的那种痛苦啊，那我的眼泪就掉下来了。然后我就想到我们慈悲的上人，他说我们要有同理心，人伤我痛，人苦我悲。那我就想到小钱行大善，就跟家人说我要1000人，在每个人的心中种下一颗种子，一颗莲子在心里面哈，大家付出就会绽放一朵莲花，期盼大家的内心有那朵莲花。
Since many hospitals in Malaysia lack medical equipment, Tzu Chi volunteers are gathering medical equipment and supplies to support the medical institutes. Tzu Chi volunteers have taken on the responsibility to gather resources.
COVID-19 많이
Currently, the pandemic situation is very serious, and we need to purchase oxygen generators. Starting from my building, I went door to door to raise funds. I told them that I'm a city volunteer, and I hope to raise 1 ringgit for each person. Under the COVID pandemic, patients desperately need oxygen generators and other medical equipment. Let's all pray that the pandemic may end soon and everyone can stay healthy and safe.
Tzu Chi volunteers are going door to door to raise funds, inviting people to cultivate blessings and do good deeds. People have responded well, hoping to support the medical workers.
I donate 1 ringgit. We do our best to help out.
While raising funds, you will encounter different people. Some of them will reject you. I'm grateful that our kind master has taught us to have a broad mind as we do things.
Doing good deeds is not the privilege of the rich. Tai Moi Tao's neighbor collects 2 ringgits from her friends and families every month to be donated to different charity organizations. This time, she has chosen to give the donation to Tzu Chi to purchase medical equipment.
From watching the news, I saw that hospitals do not have enough equipment to save the patients. My heart aches to see that. So I have a vow, and that is to gather everyone's strength to do good deeds every month. I'm very grateful that Tzu Chi has provided us with the opportunity to do our share to help people.
Tzu Chi has inspired people to support the medical workers and spread love among people. They have also gathered people's strengths in fighting the pandemic.
The Master's wish is to inspire everyone's love and planting seeds of kindness in everyone's mind. As we all accumulate our love and kindness, the disasters can be eliminated.
In order to support the nationwide vaccination plan in Malaysia, Kuala Krai District Health Office collaborated with a local hospital, initiating a mobile vaccination event, hoping that before November, the nationwide vaccination coverage can reach 80%. Here's more.
As Malaysia's COVID confirmed cases broke the 1 million mark, Kuala Krai District Health Office worked with the local hospital, providing mobile vaccination services to locals starting from June of 2021, hoping to achieve the 80% mark in vaccination coverage before November.
We must walk into villages, looking for villagers in Kuala Krai in order to get them vaccinated. This is to achieve nationwide herd immunity.
A local elementary school in Kuala Krai became a center for the mobile vaccination event as volunteers from Kelantan arrived to distribute supplies.
We're thankful to the Furniture Association. They're willing to work with us to prevent the pandemic together.
In order to increase medical workers' work efficiency, city volunteers brought 6 wheelchairs, 5 sets of beds and pillows. The Furniture Association also joined in, donating 2 laptops.
I'm thankful to Tzu Chi Foundation's contribution, allowing us to provide vaccinations for seniors. I hope we can continue the relationship after the collaboration.
Reading a blessing letter from Master Zheng Yan, the principle of saving up small donations to help the less fortunate, inspired many to donate what they could to the Bamboo Coin Bank.
This is a race with time. No one is excluded, and everyone works hard. Let's do this. I hope that we can overcome the pandemic soon, so everyone may return to their normal life once more. In Manila, Philippines, another lockdown will be set in place from August 6th to August 20th. After the 8 distributions at North Caloocan, volunteers arrived at South Caloocan to distribute 3,800 packages of supplies. Some people from the local tricycle union joined in, helping volunteers in their efforts to distribute supplies.
Before the distribution, tricycle drivers immediately joined to help city volunteers. Though they don't have income on the day and it's tiring to carry rice bags, they still insist on helping out.
Now we're receiving help from you. Thank you very much. On behalf of all the drivers, I would like to thank Tzu Chi.
This batch of supplies came just in time as another lockdown will be set in place in Manila due to the rise of COVID cases. After the lockdown, tricycle drivers will be in economic difficulties. Today arrived at South Caloocan to distribute 3,800 supplies.
We wanted to come out together because tomorrow the lockdown will be in place, so we must help more people in need.
The lockdown is coming soon. The supplies are of great help. I cannot earn enough money to buy these supplies within a day.
During the pandemic, at the Tricycle Driver Union, many people came out to assist Tzu Chi in their efforts to distribute supplies. Though only half of the people on the list can receive one package each of the rice and grains, many are generous within their hearts.
I will share rice with more people in need, especially to people who haven't received any supplies. We decided to share the received rice bags so that everyone can receive supplies. Though we cannot guarantee the fairness of distribution, everyone will still get a share of the supplies.
Because of sharing, more people in need will be benefited as no one goes hungry. Let us hope that the cycle of kindness can accompany people through the tough times.
In Tangerang, Indonesia, an old couple live in an old house that has water leakage issues. Their son wanted to spend money to repair the house, but due to the pandemic, he had little income. In March this year, Tzu Chi volunteers carried aid distribution in the area and learned about their situation. Therefore, Tzu Chi volunteers spent 45 days to repair the house.
There are watermarks on the wall and holes in the ceiling. This is where Anton called home for 24 years. Whenever it rains, his home will get flooded.
In the past, when it rained, I would worry and pray that it won't rain anymore. Whenever it rained, my home would get flooded. Sometimes, when there's a lot of water, the flood water will come in from the door.
Anton and his ill wife live in this old house. For the past year, due to the pandemic, his son has not had income and cannot repair the house. When city volunteers distributed aid supplies in March, they learned of his situation. Therefore, local volunteers started to help him.
Setiap ada bakti sosial, termasuk dari Yayasan Buddha Tzu Chi Indonesia, inilah.
Whenever Tzu Chi holds distribution here, Anton will be arranged to receive supplies first because his house conditions are poor. We also hope that one day, kind-hearted people will repair his house.
Layak huni, ada donatur yang tergerak untuk membedah atau memperbaiki rumah dari Bapak Anton.
To repair Anton's house before the rain season, city volunteers have worked together with an enterprise. They started the work by the end of May and spent 45 days to repair his house.
I'm grateful that Tzu Chi Indonesia chapter has sent people to help me repair my house. I'm very grateful to everyone. Thank you so much. Anton's house is really too old. Now that it has been repaired, he does not have to worry about leaking. They can live more comfortably.
Besides repairing Anton's house, volunteers also carry out waterproof processing so that Anton's family could live more comfortably.
In the early morning of a holiday, tenant Tzu Chi volunteers made turnip cakes for a fundraising campaign. Children are also invited to join in to help make the cakes, as it was a very special Father's Day. We will leave you with these images. Thank you for tuning in. Goodbye.